Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. SGLT and the GLUT receptors. So what are they? First, let's look at SGLT1. SGLT1 is concerned with the kidneys. That is, you have the PCT and also the presence of the intestine. Then comes SGLT2. SGLT2 means again you have the involvement of the kidney. This is again the PCT. Then moving on to the SGLT3. SGLT3 you have the presence of the small intestine and also the presence of the skeletal muscle. So you have the small intestine as well as a skeletal muscle. Then moving on to the GLUT, we have GLUT1. So GLUT is the major site for the expression. So here the GLUT, there is a GLUT1. This is the highest level of in RBC, highest level in the RBC is GLUT1. So just revising, the SGLT1 was in the kidney, 2 is again the kidney, 1 was also in the intestine, the 3 is mainly in the intestine as well as the skeletal muscle. Now moving on to the GLUT. So GLUT1, the GLUT1 is the highest level in case of the RBC. They are the main glucose transporter. So main glucose transporter. And this glucose transporter may be present in the brain. It is also present in case of the placenta, also in case of the RBC. Then looking at the moderate levels, there are the moderate levels in case of the adipose tissue, moderate level in case of the adipose tissue, and also presence in the muscles and also in the liver. Then moving on to the GLUT2. The GLUT2 you have the pancreatic. There is a pancreatic beta cell and there is a glucose sensor. So pancreatic beta cell and the glucose sensor. Then you also have the liver. This is the sinusoidal membrane, this is the liver. Then moving on to the kidneys, there is a basolateral membrane of the PCT. Then you also have the intestine. So intestine is nothing but a basolateral transporter. Now moving on to GLUT3. So GLUT1 was the highest level in RBC, main glucose transporter in the brain, placenta and the RBC. Then GLUT2, the pancreatic beta cell, the liver, the kidneys and the intestine. Then moving on to the GLUT3, the 3 is where there is the brain and the WBC. They all forms the 3. Then moving on to the GLUT4. The GLUT4 is, it involves the heart, there is a skeletal muscle and also the adipose tissue. The skeletal muscle, heart, the skeletal muscle and the adipose tissue, they are found in case of the brain. Now moving on, so the brain was found in case of the GLUT3 as well as in the GLUT4. So GLUT4 there is also the presence of the heart, the skeletal muscle and the adipose tissue. Next, moving on, there is GLUT5. So what about GLUT5? So GLUT5, there is involvement of the small intestine and also the testis and the kidneys. So small intestine, there is testis and the kidneys. Then moving on to the GLUT6. So GLUT6, there is presence of spleen. So GLUT5, the small intestine, testis and the kidneys. GLUT6 is spleen and the leukocytes. Then comes the GLUT8. The GLUT8, there is testis, there is blastocyst. So GLUT6, spleen and the leukocytes. GLUT8 is the testis, the blastocyst and the brain and the adipose tissue. Next, looking at the GLUT9. GLUT9 is where you have the liver and the kidneys. So all this is GLUT9. Then moving on to the GLUT10, there will be liver and the pancreas as well. Now moving on to the GLUT11. The GLUT11 will include the heart and the skeletal muscles. So what are the insulin sensitive GLUT? This is also very important to know. Insulin sensitive is nothing but there is a GLUT4 as well as the GLUT12. To learn and grow daily like this, please do subscribe.